Why do so many men over 60 turn to supplements? As we get older, something interesting happens. More and more men start reaching for supplements. In fact, if you're over the age of 60, there's a good chance you're already taking 4 or more different supplements every day. A pill for your heart, another for your joints, something to help you sleep, and, of course, something for your prostate. But that leads to a very important question. Can these supplements actually help shrink your prostate? Or are they just giving you false hope and draining your wallet? In this video, you'll hear directly from a board-certified urologist, someone who looks at prostates all day, every day. She'll walk you through the science, the facts, and the truth behind these popular supplements. So if you're a man over 60, or you care about one, you'll want to stick around for this. Let's get started. What is BPH, and why do so many men have it without even knowing? Let's start with something that doesn't get talked about enough. It's called BPH, or benign prostatic hyperplasia. That's the medical term. But most people simply call it prostate enlargement. Now here's the thing. BPH is not cancer. It's not life-threatening. And it doesn't mean there's anything wrong with you. In fact, it's one of the most common conditions that affects men as they age. By the time you're 50, there's a 50% chance your prostate has already started to grow. And by age 80? That number jumps to over 80%. So what exactly is happening inside your body? Let's break it down. Your prostate is a small walnut-sized gland that sits just below your bladder. Its job is to help make some of the fluid that goes into your semen. But as men get older, that little gland doesn't always stay small. It slowly begins to grow. And when it does, it starts to squeeze the urethra, the tube that carries urine out of your body. Think of it like this. Imagine stepping on a garden hose. What happens? The flow slows down, or stops entirely. That's what BPH does to your urinary system. Common symptoms of BPH include a weak urine stream, a stream that stops and starts, feeling like you have to push to get the urine out, trouble getting started when you try to pee, feeling like you didn't empty your bladder, even right after going to the bathroom more often, especially at night, sudden, strong urges to pee where you have to go and can't hold it. Sound familiar? You're not alone. Millions of men around the world deal with these symptoms every single day, but many of them don't realize that it's due to BPH. But why does the prostate grow in the first place? That's the big question, and it turns out the answer isn't simple. There are 3 major factors that doctors believe play a role. 1. Hormones. As men age, testosterone levels begin to shift. A hormone called DHT, or dihydrotestosterone, becomes more dominant. DHT stimulates the prostate to grow. This hormonal imbalance is thought to be one of the main triggers for BPH. 2. Inflammation. Chronic inflammation in the body, especially around the prostate, can also lead to gradual enlargement. Inflammation causes irritation and may set off the growth of new prostate cells. 3. Cellular growth factors. There are natural chemicals in your body that tell cells when to grow and divide. Some of these growth signals become more active as you get older. That means more prostate cells are produced, which leads to a bigger prostate. The good news? BPH can be managed. There are medications, procedures, and yes, supplements that aim to reduce symptoms or slow the growth process. But before we explore those, it's important to understand this. BPH is common. It's manageable. And you are not alone. Let's move on and talk about what supplements actually are, and how they're supposed to help. What are supplements, and do they actually work? Let's talk about supplements. You see them everywhere, in drugstores, online, even in grocery aisles. They come in small bottles with big promises. Supports prostate health. Reduces frequent urination. Shrinks your prostate naturally. But what are these supplements really? And more importantly, can they actually help? First, let's define what a supplement is. Most of the supplements we're talking about today are what doctors call phytotherapeutic. That simply means they come from plants. They're made using herbs, seeds, bark, roots, natural ingredients extracted and turned into capsules, pills, or powders. Now here's the key difference. Supplements are not medications. They're not approved or tested the same way that prescription drugs are. They're sold as dietary aids, not cures or treatments. And because of that, their quality, strength, and purity can vary a lot. So what are they supposed to do? When it comes to prostate health, most supplements work in a few key ways. They reduce inflammation. Inflammation around the prostate can make symptoms worse. And some plant-based compounds can help calm that irritation. They influence hormones. Some supplements claim to lower levels of DHT, the hormone that makes the prostate grow. They affect cell growth. Certain natural compounds are thought to slow down the production of new prostate cells, or help shrink the ones already there. Sounds promising, right? But, and this is a big but, the effectiveness of supplements depends heavily on how they're made. Not all supplements are created equal. Even if 2 bottles have the same label, that doesn't mean what's inside is the same. In fact, one study looked at 27 different brands of Saw Palmetto, a popular supplement used for prostate health. Researchers tested the active ingredient in each product, the one that's supposed to help with symptoms. And the results? Only 17 out of 27 products met the minimum standard. Some had no active ingredient at all. Others were far below the recommended dose. One product had just 5% of what it was supposed to contain. That means you could be taking a supplement every day, doing everything right, and still get no benefit simply because the product is poor quality. Here's the bottom line. Just because something is labeled as natural doesn't mean it's safe or effective. Natural doesn't mean harmless. And supplements aren't magic. Some people may see a benefit. Others may not notice any change at all. Plus, supplements can interact with medications. They can cause side effects. And they can sometimes give people a false sense of security, leading them to delay proper treatment. So what should you do? If you're thinking about taking a supplement for your prostate, here are a few simple tips. Talk to your doctor first, especially if you're taking other medications or have a chronic condition. Check the label. Look for brands that are third-party tested for purity and potency. Be realistic. Supplements may help reduce symptoms, but they likely won't shrink your prostate in a big way. At least not the way medications or procedures can. In the next section, we'll look at the most popular supplements men take for their prostate, and what the science says about each one. Let's start with the big one. Saw Palmetto. Saw Palmetto. Does this popular supplement actually help your prostate? If you've ever searched for a natural remedy for an enlarged prostate, chances are you've come across this name. Saw Palmetto. It's one of the most widely used supplements for men with BPH, and has been for decades. But does it actually work? Let's take a closer look. What is Saw Palmetto? Saw Palmetto is a small palm tree native to the southeastern United States. The part we use comes from its berries, which are rich in fatty acids and plant sterols. These berries have been used for hundreds of years in traditional medicine. But it wasn't until the 1990s that Saw Palmetto really gained popularity, especially in Europe and North America, as a treatment for prostate symptoms. How is it supposed to help? Researchers believe Saw Palmetto works through 3 main mechanisms. Reducing inflammation in the prostate tissue, which may help ease irritation and pressure. Blocking the conversion of testosterone into DHT. DHT, or dihydrotestosterone, is the hormone most responsible for prostate growth as men age. Preventing DHT from binding to receptors inside the prostate, which may reduce further enlargement and even limit some of the symptoms. These mechanisms sound impressive, and for a while, Saw Palmetto was seen as a natural alternative to prescription drugs like finasteride. But what does the science actually say? Let's talk about real-world evidence. Saw Palmetto has been studied more than almost any other supplement for BPH. And at first, small studies showed a lot of promise. But when researchers looked deeper, with large high-quality clinical trials, the results became disappointing. One of the most respected studies came from the New England Journal of Medicine. It was a randomized, double-blind, placebo-controlled trial involving 225 men with moderate to severe BPH symptoms. These men took 160 milligrams of Saw Palmetto twice a day for 1 full year. What did they find? No significant difference in symptoms compared to the placebo group. No improvement in urine flow. No change in prostate size. No better quality of life. Another major study was published in JAMA, the Journal of the American Medical Association, in 2011. This time the researchers tested higher doses, up to 3 times the usual amount, over 72 weeks. Still, they found no meaningful benefit. To put the final nail in the coffin, a Cochrane review, which is a global gold standard for analyzing medical data, combined 17 randomized trials involving over 2,000 men. And once again the verdict was clear. Saw Palmetto did not significantly improve symptoms, flow rate, or prostate size. So, why do people still use it? Because despite what the studies say, some men do report feeling better. Less urgency. Less nighttime urination. A stronger stream. That could be the placebo effect. Or it could be that some individuals simply respond better than others. Either way, it's often still recommended as a low-risk option for those who want to try something before turning to medication. Is it safe to take? Generally, yes. Saw Palmetto is considered safe for most people. But there are a few important caveats. It can affect blood clotting, so you should stop taking it 2 weeks before any surgery. It may cause mild digestive issues, like nausea or diarrhea. It can also interact with other medications, especially hormonal treatments or blood thinners. Bottom line. Saw Palmetto sounds great in theory, and some men swear by it. But when it comes to hard scientific evidence, it has not shown consistent, measurable benefits for prostate symptoms, at least not in large studies. Still, if you're curious and your doctor gives you the green light, it may be worth trying, especially if you're hoping to avoid prescription drugs or surgery. Pygeum africanum, the African plum bark that may help your prostate. Next up is a supplement you may not have heard of, but it's been around in prostate health circles for quite some time. It's called Pygeum africanum, also known as the African plum tree. More specifically, it's the bark of this tree that's used in supplements. And even though it's less famous than Saw Palmetto, it's been studied in a fairly serious way. So what does it do, and does it actually work? Where does it come from? Pygeum comes from a tall evergreen tree native to Central and Southern Africa. For generations, the bark of this tree has been used in traditional medicine, often to treat urinary problems in men. Today, the extract is used in capsule or tablet form, and you'll often find it included in multi-ingredient prostate supplements. How is it supposed to help? Like many other natural supplements, Pygeum is believed to work through several mechanisms. It inhibits the enzyme 5-alpha reductase, the same enzyme that turns testosterone into DHT, the hormone responsible for prostate growth. It may block androgen receptors, which could reduce the stimulation of prostate tissue by male hormones. It's mildly anti-inflammatory, helping to reduce irritation and pressure in the prostate and bladder. The overall idea is that Pygeum helps calm the system, reduces swelling, and improves how well you can urinate. What do the studies say? Here's where things get interesting. In 2002, a Cochrane review examined 18 randomized controlled trials involving over 1,500 men. This is a significant number of participants and a respected type of analysis. What did they find? Men who took Pygeum were twice as likely to report an improvement in overall urinary symptoms, experienced a 19% reduction in nighttime urination, had 24% less urine left in the bladder after going to the bathroom, showed a 23% improvement in urine flow rate, meaning they could urinate more easily and completely. That's promising. But there's always a but. the studies had one big limitation. The research was short-term. Most of the studies lasted only about 2 months, just 64 days on average. That means we don't really know how well Pygeum works in the long run. Could the benefits fade over time? Would side effects appear after 6 months or a year? We simply don't have enough high-quality data to say for sure. So what does this mean for you? If you're looking for something that might help with frequent nighttime urination, slow stream, or feeling like your bladder isn't emptying, Pygeum may be worth a try, especially as part of a combination supplement. But keep in mind, it's not a magic cure, and it's probably not enough for men with severe symptoms. Is it safe? Generally speaking, Pygeum is well tolerated. Most side effects are mild and affect the digestive system. Things like nausea, stomach cramps, or a little discomfort. If that happens, you can stop taking it, and those symptoms should go away quickly. Final thoughts. Pygeum africanum shows some real promise, especially in the short term. It may help reduce symptoms and improve urine flow, at least for a few months. But we still need larger, longer studies to confirm whether the benefits hold up over time. Still, if you're looking for something gentle and plant-based, Pygeum could be a helpful part of your prostate health strategy. Pumpkin seed extract. Can this natural seed help your prostate? When you think of pumpkin seeds, you probably imagine a healthy snack. Something you roast, salt, and enjoy during the fall season. But did you know that pumpkin seed extract has also been studied as a potential supplement for prostate health? That's right. This little seed, often overlooked, may actually hold some surprising benefits when it comes to urinary symptoms caused by an enlarged prostate. Let's break it down. How does pumpkin seed extract work? Pumpkin seeds contain several nutrients that are thought to support prostate function. Among the most important are zinc, an essential mineral that's found in high concentrations inside the prostate; magnesium and manganese, minerals that support muscle tone and nerve signaling; phytosterols, natural plant compounds that may reduce inflammation and influence hormone levels. But the real power seems to lie in its ability to reduce inflammation in the prostate and bladder, relax smooth muscle tissue, making it easier to urinate, increase nitric oxide levels, which may help improve blood flow and reduce tension in the urinary tract. The extract may also interact with the same 5-alpha reductase enzyme involved in DHT production, though this effect appears to be weaker than that of prescription medications. What does the research say? One of the more notable studies involved 476 men who were randomly assigned to take either 2 500 mg capsules of pumpkin seed extract daily, or a placebo for a period of 12 months. The results? Men in the pumpkin seed group showed a 65% improvement in urinary symptoms, based on validated questionnaires. The placebo group also improved, by 54%, which shows how powerful the placebo effect can be. However, there was no significant improvement in urine flow rate, residual urine left in the bladder, PSA levels, or prostate size. So while the symptoms got better, the deeper physical measurements didn't really change. Another study with 1,400 participants compared 2 versions of pumpkin seed: the extract form at 500 mg twice a day, and the whole seed form at 5 grams twice a day. Again, the results showed some improvement in symptoms, but no major changes in objective measures like prostate volume or urinary speed. Is it safe to take? Yes. For most people, pumpkin seed extract is considered safe and well tolerated. That said, there are some important points to remember. It's rich in minerals, especially zinc and phosphorus. If you're already taking other supplements that contain these minerals, you could end up getting too much. If you have kidney disease, talk to your doctor before taking it. High phosphate levels can be a problem in people with impaired kidney function. Some users report mild digestive discomfort, such as bloating or soft stools. These side effects are usually temporary. So, should you try it? Pumpkin seed extract may not shrink your prostate, but it could make your bladder feel more comfortable, especially if you struggle with urgency or frequency. It's not a quick fix, and the effects may take a month or two to become noticeable. Still, if you're looking for a natural low-risk option, pumpkin seed extract is worth considering, especially when used as part of a broader strategy for managing BPH. Beta-Sitosterol, the plant sterol with potential. If you've ever looked closely at the label of a prostate supplement, you might have seen a word that's hard to pronounce: Beta-Sitosterol. It doesn't sound as familiar as Saw Palmetto or pumpkin seed, but don't let that fool you. Beta-Sitosterol is a key ingredient found in many multi-ingredient prostate formulas, and there's some real science behind it. Let's take a closer look. What is beta-sitosterol? Beta-sitosterol is part of a group of compounds called plant sterols, naturally occurring substances found in fruits, vegetables, nuts, and seeds. They have a structure similar to cholesterol, but they behave differently in the body. For years, beta-sitosterol has been used to help lower cholesterol levels. But more recently, researchers have started looking at its role in prostate health. How does it work for BPH? The exact mechanism isn't fully understood, but several theories suggest that beta-sitosterol may help by reducing inflammation in and around the prostate gland. Inflammation can make BPH symptoms worse, especially when it affects bladder function or causes swelling. Improving urine flow by relaxing the muscles around the bladder, neck, and urethra. This could lead to easier, more complete urination. Promoting apoptosis, a process where unwanted or overgrown cells are encouraged to die off naturally. This may slow the growth of the prostate over time. Unlike other supplements, beta-sitosterol doesn't seem to affect DHT levels directly. Instead, it may act more like a modulator of inflammation and cell turnover. What does the research say? A Cochrane review published in 1999 looked at 5 randomized controlled trials involving over 500 men with moderate to severe BPH symptoms. And the results? Men who took beta-sitosterol reported a significant improvement in urinary symptoms. They also had better urine flow rates compared to the placebo group. That's encouraging. And here's the catch. There was no measurable change in prostate size. So while beta-sitosterol may help you feel better, it won't actually shrink your prostate. How does it compare to other supplements? In terms of symptom relief and urine flow improvement, beta-sitosterol holds up surprisingly well. It may not have the name recognition of Saw Palmetto, but in controlled studies, it has performed just as well, and in some cases better. That's why you'll often see it included in combination products, alongside other ingredients like Pygeum or pumpkin seed extract. Is it safe? For most people, yes. Beta-sitosterol is generally well tolerated. However, some users report mild digestive issues including constipation or diarrhea. These are usually mild and go away on their own. If you have high cholesterol and are already taking cholesterol-lowering medications, it's a good idea to talk to your doctor before adding beta-sitosterol, as it could enhance the effects. Bottom line, beta-sitosterol won't shrink your prostate, but it may improve how you feel. Better flow, less urgency, fewer trips to the bathroom. It's not a cure, but it's one of the better studied supplements available. And if you're looking for symptom relief without turning to prescription drugs just yet, this plant-based option could be worth adding to your daily routine. Stinging nettle, the root with a sting and a purpose. The name doesn't exactly sound inviting. Stinging nettle. If you've ever brushed up against this plant in the wild, you probably remember the unpleasant sting, a sharp, itchy irritation that can last for hours. But what if I told you that the very same plant that causes that sting might also have the power to help with symptoms of an enlarged prostate? Let's take a closer look at what stinging nettle root can and can't do for men with BPH. What is stinging nettle? Stinging nettle is a perennial plant found in many parts of the world. It grows in damp soils, abandoned fields, and forest edges. While the leaves are known for their sting, the root is the part used in most prostate health supplements. For centuries, nettle root has been used in traditional European medicine to treat urinary problems in older men. Today, it's often found alongside Saw Palmetto in combination supplements. How does it work? Like many plant-based remedies, stinging nettle appears to work through multiple mechanisms. Anti-inflammatory effects. It helps calm the tissues in and around the prostate and bladder. Anti-growth properties. Nettle may help reduce the activity of growth factors involved in prostate enlargement. Hormonal interaction. Some studies suggest it may interfere with the binding of sex hormone-binding globulin, SHBG, to androgen receptors in the prostate, possibly reducing stimulation and growth. However, unlike medications like finasteride, nettles do not directly block DHT production. Their action is milder and more supportive. What does the research show? The strongest evidence we have comes from a randomized controlled trial that combined 160 milligrams of Saw Palmetto with 120 milligrams of stinging nettle root extract, taken twice daily over a period of 48 weeks. At the end of the study, men taking this combination showed improved urinary symptoms, better flow rates, and a reduction in nocturia, or nighttime urination. After 48 weeks, all participants were switched to the active supplement and continued for up to 96 weeks, nearly 2 years of follow-up. The improvements held steady with no major safety issues reported. That's a pretty strong case, especially when compared to many short-term studies for other herbs. Is stinging nettle safe? For most people, yes, but with important precautions. Stinging nettle can interact with iron supplements, reducing their absorption. Lower blood sugar, which can be risky for people with diabetes. Decrease potassium levels, especially when combined with diuretics. Affect blood clotting, meaning you should avoid it before surgery. Cause rare allergic reactions, like rashes, swelling, or hives. So if you're on blood thinners, diuretics, lithium, or diabetes medications, stinging nettle may not be the right choice for you. Always check with your doctor before adding it to your supplement routine. Bottom line. Stinging nettle root, especially when combined with Saw Palmetto, has shown real promise in improving BPH symptoms, particularly over the long term. It's not a cure. It won't shrink your prostate significantly, but it may make life easier. Fewer trips to the bathroom, stronger flow, and less urgency. If you're in generally good health and not taking conflicting medications, this plant with a sting just might be worth considering. Lycopene, the antioxidant powerhouse in your kitchen. Now we arrive at a supplement that isn't sold in fancy bottles, doesn't come with marketing gimmicks, and might already be sitting in your refrigerator. It's called Lycopene, a powerful antioxidant that gives tomatoes, watermelons, and pink grapefruits their bright red color. But what does it have to do with your prostate? Quite a lot, actually. Let's dive into why lycopene has become one of the most talked about natural compounds in prostate health. What is lycopene? Lycopene is part of the carotenoid family, a group of plant-based pigments that also includes beta-carotene. It's fat-soluble, meaning it gets absorbed best when eaten with healthy fats like olive oil. Unlike some other supplements, lycopene is primarily known for its antioxidant properties. It helps fight free radicals, unstable molecules that damage cells, speed up aging, and may contribute to chronic diseases. In the case of the prostate, lycopene seems to interfere with oxidative stress and inflammation, two major factors that may contribute to prostate growth over time. How does lycopene help with BPH? Researchers believe that lycopene may slow prostate cell growth by reducing the activity of growth factors like IGF-1, decrease oxidative damage to prostate tissue, lower inflammation, which may help relieve urinary symptoms, potentially affect hormonal balance, although this is still under investigation. Importantly, lycopene doesn't shrink the prostate directly, but it may help prevent or slow down the enlargement process. That makes it more of a long-term support compound, rather than a fast-acting symptom reliever. What does the research say? Here's where things get a bit tricky. There is no single randomized controlled trial, or CT, focused solely on lycopene for BPH. Instead, what we have are meta-analyses and reviews of smaller studies. One such analysis looked at about 2,000 patients across several studies. Doses varied wildly, from 10 mg twice a day to 500 mg per day. Study durations also varied, ranging from a few weeks to 6 months. Some studies showed improvements in urinary symptoms, PSA levels, a marker of prostate activity, and oxidative stress indicators. But because the results were inconsistent, and the study designs weren't standardized, experts say we still need higher quality research before making firm conclusions. Food or supplement? What's better? Most doctors agree. If you want to try lycopene, start with food first. Great sources of lycopene include cooked tomatoes and tomato paste, watermelon, red bell peppers, pink grapefruit, and papaya. In fact, cooking tomatoes in olive oil increases the bioavailability of lycopene, making it easier for your body to absorb. That said, if you can't tolerate tomato products, or have bladder irritation from acidic foods, then a lycopene supplement may be a gentler option. Is it safe? Lycopene is considered very safe when consumed through food. In supplement form, it can affect blood clotting, so it's best to stop taking it 2 weeks before any surgery. Also, if you're taking blood thinners, always check with your doctor first. Final thoughts. Lycopene isn't a miracle cure, but as a natural antioxidant, it offers a lot of potential for long-term prostate health. It may not dramatically shrink your prostate, but it can support your body in reducing inflammation and oxidative stress. And the best part? You can start using it today, right in your kitchen. What you need to know before taking prostate supplements. By now, we've looked at the most common supplements used for prostate health. From Saw Palmetto to pumpkin seed, from Beta-Sitosterol to Lycopene. You've heard the mechanisms. You've seen what the studies say. And you may be wondering, if the data isn't strong, why do so many men say they feel better? That's where we need to talk about something called the placebo effect, and how it plays a major role in almost every supplement story. Is it real, or is it just in your head? Imagine this. You take a new supplement for your prostate. Within a few weeks you start feeling better. You're waking up less at night. Your stream feels stronger. You don't feel that constant urgency anymore. Naturally, you credit the supplement. It must be working, right? Well, maybe. But here's the truth. Your brain is incredibly powerful. When you believe that something will help, your brain can actually trigger real changes in how your body feels and responds. This is called the placebo effect. And it happens even when the pill you're taking has no active ingredient. In fact, some of the largest clinical trials on supplements, including the ones for Saw Palmetto and pumpkin seed extract, found that the placebo group improved almost as much as the treatment group. That doesn't mean the people were faking it. They weren't. Their symptoms really did get better, just by expecting to feel better. This doesn't mean that supplements are useless. Far from it. But it does mean we need to be honest and realistic about where their effects might be coming from. So are supplements worth trying? The answer is, maybe, depending on your goals. If your symptoms are mild to moderate, and you're looking for something natural, you may absolutely benefit from trying a supplement, even if the benefit is partly due to the placebo effect. If you're sleeping better, urinating less often, and feeling more in control, then that's still a win. But if your symptoms are severe, if your bladder isn't emptying fully, or if you're facing long-term complications, a supplement alone probably won't be enough. That's when you should talk to your doctor about prescription medications or procedures. When should you stop taking a supplement? Not all supplements are harmless. In fact, there are some important red flags you need to watch for. Let's go over a few situations where you should stop taking a prostate supplement immediately. 1. Digestive problems. Many supplements can cause mild gastrointestinal side effects, such as nausea, stomach cramps, diarrhea, constipation. If these symptoms start soon after you begin a supplement, especially if they're severe or long-lasting, stop taking it and give your body time to recover. If the symptoms persist, don't guess, talk to your doctor. 2. You have existing health conditions. Some supplements may not be safe for men with certain chronic illnesses, especially kidney disease, due to high levels of minerals like phosphorus or magnesium. Liver conditions, since some herbal extracts are processed in the liver. Heart problems, which can be aggravated by hormonal or electrolyte changes. Diabetes, because certain herbs like stinging nettle may lower blood sugar unexpectedly. If you fall into one of these groups, always speak with your physician before adding any new supplement to your routine. 3. You're preparing for surgery. This is a critical warning. Many natural supplements can affect blood clotting, including Saw Palmetto, Lycopene, stinging nettle. Even if they seem mild, these supplements can increase your risk of bleeding during and after a procedure. If you're scheduled for surgery, even something routine, you should stop all supplements at least 2 weeks in advance, unless your surgeon advises otherwise. Final thoughts. Supplements can be helpful, but they're not miracle pills. They may help you feel better. They may ease your symptoms, but they rarely offer the same level of effect as medications or medical procedures, especially for moderate to severe BPH. Still, for the right person in the right situation, a supplement can be a low-risk, worthwhile experiment. Just remember, know what you're taking. Monitor your symptoms closely. And always talk to your doctor before starting or stopping any supplement, especially if you have underlying health conditions. What if supplements don't work? Exploring medical and surgical options. By now, you've learned that supplements can help, but their effects are often mild and results vary from person to person. So what happens if you've tried Saw Palmetto, pumpkin seed, Lycopene, and nothing really changes? Maybe you're still waking up 3 or 4 times a night. Maybe your stream is weak. Maybe you constantly feel like your bladder isn't empty. If supplements aren't enough, don't worry, you still have options. Let's talk about medications and medical procedures. The gold standard treatments for moderate to severe BPH. Prescription medications for BPH. There are 2 main categories of medications used to treat an enlarged prostate. 1. Alpha blockers. These include familiar names like tamsulosin, brand name, Flomax; alfuzosin, brand name, Urologist; doxazosin, and others. These drugs work by relaxing the smooth muscle in the bladder, neck, and prostate, which makes it easier for urine to pass through. Benefits: often work quickly, sometimes within days. Improve flow and reduce urgency. Well tolerated by most men. Drawbacks: can cause dizziness or lightheadedness, especially when standing. May cause ejaculation issues. Don't reduce the size of the prostate. 2. 5-alpha reductase inhibitors. The most common drugs in this category are finasteride, brand name, Proscar; dutasteride, brand name, Avodart. These medications work by blocking the enzyme that converts testosterone into DHT, the hormone that drives prostate growth. Benefits: can shrink the prostate over time. Reduce the risk of long-term complications. Often combined with alpha blockers for greater effect. Drawbacks: take 3 to 6 months to show results. May cause sexual side effects, including decreased libido or erectile dysfunction. Not suitable for everyone. When medications aren't enough, sometimes even with the right prescription, symptoms don't go away completely. Or maybe the side effects are too bothersome. That's when your doctor might recommend a minimally invasive procedure. Here are a few of the most common. Urolift. A small implant lifts and holds the enlarged prostate tissue out of the way. No cutting, heating, or removal of tissue. Quick recovery, typically done in an outpatient setting. Best for men with moderate symptoms and smaller prostates. Reason: uses water vapor steam to destroy excess prostate tissue. Performed in office. Takes several weeks to notice full improvement. Often used when medications fail or cause side effects. TURP, transurethral resection of the prostate. Considered the gold standard surgical treatment. Removes parts of the prostate through the urethra. More effective for larger prostates or severe symptoms. Involves a short hospital stay, but offers long-term relief for many men. When should you consider a procedure? Surgery or minimally invasive therapy might be right for you if your symptoms are severe and affecting your quality of life. You've tried medications or supplements without success. Your bladder isn't emptying properly. You're still relatively young and want to preserve long-term bladder health. You're experiencing complications such as frequent urinary tract infections or bladder stones. Final thoughts. There's no shame in needing medical help. BPH is a mechanical problem. Your prostate is pressing against your urethra. And sometimes that pressure is simply too much for herbs or pills to fix. If supplements aren't giving you the relief you need, talk to your doctor about the options we've covered here. There are safe, effective treatments available, and they could make a life-changing difference in how you feel every single day. What really matters for your prostate health? Let's take a step back and put everything into perspective. You've heard a lot today. We've gone through the most common supplements for prostate health. We've talked about how they work, what the research says, and when they might help. We've also looked at the hard truth that many supplements, while promising in theory, don't always hold up in large, high-quality studies. But that doesn't mean they're useless. Some men still feel better. And if a supplement gives you relief, even a little, without side effects, that may be all you need. It's about your quality of life. At the end of the day, it's not just about numbers on a lab report. It's not just about prostate size or flow rate. It's about how you feel. Can you sleep through the night? Are you comfortable leaving the house without planning your bathroom stops? Do you feel like you're in control? That's what matters. And if you're not there yet, you have options. What should you do next? Here's a simple way to think about it. If your symptoms are mild, and you're not ready for medications, trying a high-quality supplement may be worth it. If your symptoms are getting worse, or you've already tried supplements without success, talk to your doctor about medication or procedures. And if you're unsure where you fall on that spectrum, just start with a conversation. A visit to your urologist can give you clarity and peace of mind. Don't wait too long. One of the biggest risks with BPH isn't just discomfort. It's doing nothing while your bladder works harder and harder to push past the obstruction. Over time, that pressure can weaken the bladder, making it harder to bounce back even if you get treatment later. So if you're young or still in good shape, early action now can protect your long-term urinary function for years to come. You're not alone. Millions of men are navigating this exact same issue. And thankfully, there are more tools than ever to help you feel better, stay active, and live life on your terms. A final reminder. Here's what we want you to remember. Supplements can help, but they're not miracle cures. Always check for quality and be realistic about what they can do. Don't ignore side effects, and never mix supplements with medications without talking to your doctor. If symptoms are affecting your life, there are safe and effective treatments available. If this video helped you, please subscribe to the channel and share it with a friend, brother, or father who might be dealing with prostate symptoms. And if you want more in-depth content, early access to interviews, and exclusive Q&A sessions, consider becoming a premium member to support the channel and your health. Thank you for watching. Take care of yourself. And remember, your health is worth protecting.